Perfect. Okay. My name is Erica. I am the community manager here at AskVet. And today we have Dr. Marks talking to us about common toxins in and out of the house. So I'm going to go ahead and let her take it away. And like I said, if you have comments, feel free to drop them in the chat box.
Sounds great. Hi, everybody. Yeah, this is, unfortunately, it's not a super sexy topic to be talking about, like some of our behavior and some of the diseases that we're trying to prevent or treat, but a huge necessity for brand new pet parents or experienced pet parents, or if you're pet sitting or doing anything with dogs or cats, really important to know what's safe and what's not safe in and outside of the house. So we're going to go through some of the more common ones. And as I was telling Erica earlier, this is a whole semester of work for veterinary students with a textbook about yay thick to learn all about toxicities and how they cause problems in our patients and how we treat them. So as you can imagine, I'm going to do my best to give you some highlights over the next 15, 20 minutes, but I can't go over everything. So I'll feature some of the most common ones, and then feel free to shoot any questions in the chat and I'll do my best to answer them as quickly as I can. So I want to start with probably one of the most well-known toxicities, and I say that in quotes, for dogs and cats, and that's the poinsettia plant that, of course, many people have in their homes or outside and on their porches during Christmas season. And this plant gets a bad rap because, yes, while it can cause some tummy upset, some diarrhea and occasional vomiting, it's really not this toxic substance that we all need to be running for the hills for. Do we want poinsettias in our house? Well, if you only have dogs and you can place this in a safer spot, elevated and away from reach, totally fine. Cats are a different story, right? Because they live vertically. But this is typically not a case where we have to rush our dogs or cats to the ER if they've chewed on a leaf. Most of the time, again, if anything, it's going to be a little GI upset, but not these emergent situations that some of these toxins I'm going to share with you can create. And forgive me, I'm not sure why this red line came across the screen. It came across from Gina. So I'm not sure what lit up there. I'm not sure when she joined, if something happened from her Zoom, but forgive that. So looking here, these are some of the more common and worrisome toxicities for me when we're dealing with some of our poisonous foods that we consider harmless to humans, but can be life-threatening to our dogs and cats. We'll go over some of these, especially xylitol in grapes, in a little bit. But really important to remember that toxins for pets don't always have to be the cleaners and the bleaches and the medications that we think about. It could be something as innocent, again, as a grape that to us, we buy, without a thought in the grocery store, or feed to our kids. But one grape can actually cause a dog to go into kidney failure irreversibly. So again, just a reminder before we get into some of the most common ones, that it's really important to remember dogs and cats process foods and medications and all kinds of therapies very differently than we do, especially cats. And so what might be safe for us doesn't always mean it's safe for them, especially when we're talking about some of these foods. So I just thought I'd share with you these the top 10 list of pet poisonings that we saw during the pandemic. And this is from Pet Poison Hotline, which is a great, I'll give you that number, and it's at the bottom right there that you can record down. It's a really great resource for every pet parent and veterinarians like myself. But you look and see there's a really big shift the pandemic created in what our pets are getting into. So tons of people were making bread. You see yeast significantly rose as a toxicity. Same with bread dough. Bread dough is actually a huge problem because when dogs especially eat this, it will then expand in the stomach, and we can see really bad bloats and other obstructions that way. People, of course, were doing lots of artsy stuff, still are. So we see art supplies and paints being another big one that has come up. Cleaning products and alcohol and marijuana are always on the list. So, but they did increase significantly. And as did wine, which I know my wine intake did increase a little bit during the pandemic from all that stress. But just to let you know, again, these are all pet toxicities, things that we normally don't think about, especially our bakers out there that are using yeast and making dough. If that's left alone and you have a table or counter surfer as a dog, you have to be very wary because those can create some life-threatening situations. So let's start with dogs and some of the more common toxicities that we see that I see all the time, actually, and certainly pet poison does too. And I'll start with, again, probably one of the more well-known ones, which is chocolate. Chocolate, again, similar to poinsettias, is what we consider dose dependent. So if you have a Great Dane and your Great Dane eats one mini chocolate chip, if you called me, I would say, I really don't care. Meaning that I don't care that there's going to be any effect to your dog. That's considered negligible. It is all about the type of chocolate and the amount of chocolate that dogs get into. Cocoa powder is really the critical component. And then the compound in there is something called theobromine. But the higher the cocoa, the more dangerous the dog. So baking chocolate, if you look at this, 2 ounces of baking chocolate is a toxic dose to a 20-pound dog. So when I'm worried about our dogs, again, if they've gotten into straight cocoa powder, semi-sweet chocolate, dark chocolate is really bad. These are dogs that are going to have at first what looks like sort of a caffeine rush. So they might have vomiting and diarrhea. They're going to have a really fast heart rate. They might seem restless, anxious, jittery kind of thing. But then again, as this progresses, we can start to have arrhythmias, so abnormal rhythms with their heart. We can have seizures. We can have a lot of life-threatening situations. So chocolate, again, it's really dose dependent and type dependent. The more cocoa we have, the higher the amount, the smaller the dog. Again, that's kind of the perfect storm. So do I tell every pet parent, don't ever have chocolate again in your house? Absolutely not. Chocolate is part of my food groups. No, but we have to be, just like if we were thinking about with children and dangers, we have to be really cognizant when we're baking. Definitely want to keep our dogs out of the kitchen. If you have young children who are eating chocolate chips or chocolate bars or Hershey Kisses or all these kind of things, again, really important to separate your dog. And if you have these in your house, they belong on a high pantry or locked up. Use a child safety lock if you have a really mischievous guy that's trying to get into them. Now, xylitol is a big one that I want to spend a little more time on. And the reason I do is because you see this picture with all of the different products now that contain xylitol. So xylitol is a sugar-free substitute. In humans, it's a wonderful invention because it's allowed diabetics and other people who need sugar-free alternatives to have a lot of really great food. That's how it started. And then, of course, it got put into a lot of different things like sugar-free gum and jellies and a lot of toothpaste, especially for kids, nasal sprays, laxatives, cough syrup, mouthwash. I mean, you name it. There's quite a few here that we need to be aware of. Xylitol is, unlike chocolate, xylitol can be life-threatening with small amounts. So my classic worry is when one of my clients calls me and says, you know, my boxer Jimmy just got into my backpack and ate all my Orbit gum. That can be a big problem because what we see at first is vomiting and what we call ataxia, which is kind of lack of coordination, sort of like they're kind of walking as if they were drunk. But what ends up happening as it progresses is that these dogs get very low blood sugar. We call that hypoglycemia. And when that happens, they can have life-threatening seizures. They can go into liver failure and actually into a coma. And the problem with xylitol for us is that usually we only find out about it when it's very late. So if your dog got into some gum and you didn't check your backpack or your purse for a while, that could be sitting there processing as a toxicity, and we don't have a lot of time to change that or reverse it. So super, super important to keep these, again, either out of your house or in places that are secure that your dogs and cats too, but mostly dogs don't have access to. because these can be very life-threatening very quickly. And again, that's xylitol. When in doubt, look at the label on the products that you have in your home and make sure that if xylitol is there, again, that is out of access for any dog to ingest. Now, I said grapes and raisins at the beginning, and grapes and raisins are a funny thing. Just recently, in the last 6 months, there's been a breakthrough in research about why these grapes, and again, raisins and prunes, can cause kidney failure. And I won't bore you with the whole biochemical pathway, but it is the next step in figuring out why one dog, let's say a Yorkie, could eat 20 grapes and have no problem, and a lab could eat 1 grape and go into kidney failure. And that sounds crazy, but that's exactly how it happens. And right now, at least as of today, we don't have a great screening test to determine which dogs are affected and which dogs aren't. There's obviously something in the processing. Maybe it's genetic, maybe it's also biochemical. We don't know yet, but we err on the side of caution because we know that 1 grape or raisin can kill a dog by putting them into, again, end-stage kidney failure. Now, this is just like xylitol. Sometimes we don't know about this until it's very advanced. If a toddler was throwing grapes and, you know, the family member didn't catch it, or it's a summer barbecue and somebody had a fruit salad, you didn't know they had grapes in it, whatever the case may be. But these dogs typically show similar signs to xylitol, vomiting and not eating, but then they start to show signs of kidney disease, like increased thirst and urination, and we end up seeing kidney failure on their blood work when we check. So I always, again, err conservatively here. And if your dog has gotten into a grape, because we don't know which dogs can tolerate it and which can't, I always say, see your veterinarian, because it's better to be safe than sorry. And we can certainly check those kidney values and see how your dog is doing. Some dogs have to stay in the hospital, some don't. Again, it's a little variable depending on how your veterinarian treats this. But until we have a better screening test, again, err cautiously. We don't want to miss something and have it be too late. Now, over-the-counter and prescription medications are always a big problem for dogs. This past year, 17% of toxicities were from ibuprofen and acetaminophen. So acetaminophen being Tylenol. Tylenol can be life-threatening in cats, but also the same in dogs. We just don't hear about it as much. But we also saw 15% of toxicities being called into the Pet Poison Help Hotline from antidepressant medications. These are all human therapeutic prescriptions. Anticonvulsants like phenobarb to stop seizures, heart medications, and then topical creams. This is a huge newer toxicity that we're seeing, especially people who are on a medication called 5-FU, which is 5-fluorouracil. It's a topical cream to treat some of the weaker skin cancers. So not like a melanoma, but the ones that can be treated at home with therapeutic medications. Dogs and cats that get into that medication, that is almost always life-threatening. And it doesn't take much for dogs to pierce a tube, right? So if you think about like a tube of toothpaste, it wouldn't take much for them to pierce that and start to lick it. They can also, if you're applying something transdermally, so something like a lotion on your skin, and your dog licks it off after you've applied it, they can have, of course, the same impact that you are receiving the drug. So super important anytime you have therapeutic medications or over-the-counters like Tylenol and Advil and some of the others we commonly keep, to make sure that they are securely locked or in a high cabinet, that they aren't left, you know, kind of loose in a open garbage can, that you're not mistaking your medications for your dog's medications. Make sure they're very easily and clearly labeled, especially if you have pet sitters or other family watching them when you're traveling, to make sure there's no mixing. And if you notice anything that's been ingested, you need to call Pet Poison Hotline or ASPCA, any of the helplines that are out there right away, so that we can get a sense of what next steps are, because they're all a bit different depending on the drug. And then I bring this up, not that it happens that commonly, but it's a type of toxicity that is a little bit different, and that's batteries. So batteries often are chewed when dogs are getting into kids' toys. where they're, piercing something and then a battery comes out, or they accidentally ingest it, or they're chewing into it, they puncture the battery and the inside of the battery leaks out. The issue there is that the material inside can either be alkaline or acid, so corrosive essentially. And when those dogs either eat it or they lick the punctured material, it can corrode the mouth, corrode the lining of the esophagus, and even the internal organs. The reason it's different is because when we are dealing with something like this, most of the time when we see a pet poisoning, we will start with clearing out the stomach. So in human medicine, you think of people getting their stomachs pumped. We don't really pump stomachs in dogs, but we do often induce vomiting in the hospital with a medication that causes patients to vomit, to expel whatever's in their stomach. That's a decontamination technique for us. However, with batteries and bleach and other things that can cause erosion, we don't cause the patient to vomit. As you can imagine, if I did that, they could erode all of the stomach, all of the esophagus, all of the mouth, everything. And we can end up with a really, really sick and critical patient that way. So we evacuate things differently, but just again, something really important. If you know that your dog has gotten into batteries, very, very important to tell your veterinarian that it is batteries, because we do treat that toxicity differently because of the corrosive material inside. Now let's shift over to cats for a minute. The big one for cats, and I don't like to tell people how to have their home. I think everybody should make their peaceful space the way they want to, but I am going to say one thing here, and that's never have a lily in a house with a cat. Boom. That's it. There is no wiggle room there. Please don't have lilies there, because all parts of those plants are poisonous. The stems, the leaves, the pollen, the flowers. This little sweetheart has just dusted her cute little muzzle in the stems of this lily, and that can be toxic. And unfortunately, there is no return. When these cats get into lilies, they go into irreversible kidney failure. And I have seen cats as young as 6 to 8 weeks old, sadly, have that happen. And that's devastating to the patient, but also to veterinarians and of course to the families. So if by chance a cat has gotten into a lily, you want to bathe, brush, get that cat immediately to a veterinarian so that we can do supportive care in every way possible. This is just the one where prevention is by far the best medicine. Just no lilies where there's cats, just period. I wish that was a standard, but we still see this toxicity quite frequently. So don't send lilies to people who have cats. I know they're beautiful flowers, but look at them from afar and make sure that your cats are staying safe at home. Antifreeze is a big one too. Now in the winter months, we tend to see this more frequently, but remember, this is this blue fluid that's used to prevent the fluids inside your car from freezing. And very common to see this kind of dripping in a puddle under cars or in garages, in driveways, or in alleyways. And it contains ethylene glycol, which is an alcohol derivative that will create failure in a lot of different organs for cats. So cats start by looking like they're vomiting and having lack of appetite. They can look like they're stumbling and drunk and having some of the same things we see with grapes, because that's kidney failure stress, and that's increased thirst and urination. But this can cause changes in the nervous system, in the hearts, in the lungs, in the kidneys. This is a devastating toxin. So a couple things of note there. One, always want to be checking your driveway, your garage, anything where you have a car parked or a neighbor has a car parked, to look for puddles. Certainly, of course, the water that comes out of your air conditioner, a different story, but especially in the winter time, making sure that we don't have those. And if your cat, of course, does go outside, that they don't have access to those puddles. The second thing is if you know that your cat has gotten into antifreeze, just like the batteries, you need to tell the veterinarian right away. Most emergency clinics have a test that can detect if your cat has been exposed to ethylene glycol. And then there is as close to an antidote as I can say. There is one here where it tries to combat the effects of the ethylene glycol. Sometimes it's more successful than others. Again, biggest thing is prevention. Avoidance is definitely the best thing here. Now, rodenticides. We see this in dogs too. But outdoor cats, a lot of times we will see this. And I put some pictures up here of some of the more common looks to this, because I think for many of us, we don't have a lot of exposure to what municipalities and other cities put out for rodent control, but they tend to be either pink or blue pellet-like products that go, again, alleys, building, hallways, things like that, garages, to try to control rodents. However, a lot of times they are baited with meatballs in the summer and things that are much yummier than the municipalities would think. And our dogs, just like the rodents, are attracted to it, as well as cats. And we end up them ingesting what are called anticoagulants. And so these are chemicals that prevent the body from clotting. So instead of blood staying in the vessels where it needs to be, it oozes out of a lot of different places. The reason that these are really nasty is because often we don't see this for days, because the chemicals that are used now are sneakier and they have delayed impact in the body. So if your dog or cat eats some of these outside and comes back in at dinner time, or does this from the backyard, they may act normal for 2, 3, even 4 days. And by the time they start acting abnormal, a lot of times they're in a very advanced state of toxicity. So again, really important, if you take your dog in alleyways, important to keep them on a leash and watching them all times. It's always a good idea to walk the perimeter of your backyard, make sure you don't see things like that, that could have been accidentally kind of contaminating in that area. Or if you take them to a park, always look out for these granule pellets, especially if they're clumped in certain corners, or again, where there have been previous rodent sightings. Because once these dogs and cats see these and ingest them, the clotting sometimes can be reversed, sometimes it can't. And these dogs and cats can also go into kidney failure. Now, I mentioned garlic and onion because I think a lot of people kind of blow these foods off. Similar to poinsettias, that, oh, maybe there'll be a little bit of tummy upset and that's about it. However, in cats, these two are really, really difficult to treat, because just a 1/4 cup of onion can make a 20-pound dog sick, and it can make a 10-pound cat sick. What these two do is they affect the hemoglobin, which is the part of the red blood cell in our body that actually holds the oxygen. So it is critical to our survival. And they basically destroy this ability to have oxygen in the red blood cells. So these cats act like they are being starved for the ability to breathe normally. And we see them very anemic, which means their red blood cells are not healthy and not being produced. So they're really tired and weak, and they have very pale, almost white gums. You can see red urine coming out of them based on some of the reaction of these red blood cells dying and being excreted. These are some really sick cats. So again, just like I wouldn't tell you to never have onion and garlic in your home again, treat these with kid gloves when you are cooking with them. Make sure you cook and clean up and have a covered garbage can, and your cat cannot get into this. If you're cooking and you have cats, please don't leave the kitchen and go do something else with things on the counter. Remember, cats live vertically, not horizontally. They will get to wherever you think they can't get to. This can be a really big problem. And often, just like with rodenticides, we don't notice it until it's much later on. And then household products and cleaners. I mentioned some of those prescription and over-the-counter meds, but here are some of the other ones that can be toxic to pets, especially cats: paint, spackle, some of the do-it-yourself home improvement products. I mentioned bleach before, but carpet fresheners are really bad. Fabric softeners and dryer sheets, grout. The Swiffer Wet Jet, you probably heard some popular press about that several years ago, but all of these things, if you're doing a lot of construction work in your house, really important to talk to whoever is doing this work. Look to see if you can use as many pet safe products as possible. If that's not possible, make sure that your cat has a secured room when all of these improvements are happening, so that they're not, because cats are incredibly smart and very curious, that they're not exploring these construction areas and work areas and getting their either their feet or their whiskers or their mouth into things that we shouldn't have them getting into. And then just the other few that I want to make sure we mention, just toxins to avoid, because I can't get to all of them today. Essential oils. I mentioned the bleach and antifreeze, jade plants and sago palms and rhododendrons. These are up here. These can cause quite a few changes in both dogs and cats. In fact, sago palms really can be deadly, as can jades. Raw eggs. You know, a lot of people sometimes use these, especially in some of the more health-based diets. Those can carry a lot of bacteria and can cause problems, especially in cats. And then, of course, the alcohol and wine products you saw at the beginning have really increased since the pandemic. So if you notice and that your pet has gotten into one of these things, or it's something that I didn't even have on my list, but you know is probably not something that a dog or cat should have, these are just some steps that I would say are fairly universal for every dog or cat and for every pet parent to remember. First thing you want to do is get your pet out of that area. If it's a work area or a cleaner spill or rodenticides, whatever the case, we want to get them out of the area. Make sure that your pet is breathing. Obviously, if your pet is not breathing, you're going right to the ER, of course. Do not give anything from home that you consider or maybe have looked up and read somewhere as an antidote. In veterinary medicine, there are very few antidotes, and they are prescriptive and only administered in the hospital, typically IV. So there aren't easy fixes at home. And as we mentioned with bleach and batteries and some of these corrosive agents, the last thing we want to do is try to give hydrogen peroxide and have your pet vomit and make your pet much, much worse. So that's, again, 4, do not induce vomiting unless your veterinarian or the pet poison helpline has directed you to. And here is that really important number to save in your phone, have on your fridge, share with friends. Really, really helpful. 24/7, 365. You can call them and they'll walk you through what to do. Some of the things that we think might be poisonous actually, at worst, like I said, might cause some GI upset. And like I said, some of the things that we kind of overlook can be some of the worst. So these are the experts that will really help you and me as a veterinarian do the best. And then again, also really helpful to have your veterinarian on speed dial and know your local emergency clinic, know where it's at, and also have their number in your phone so that if it does happen, and certainly accidents happen, you know, more often than we would like them to, even with the best planning and best intentions, just want to make sure that we're not struggling to figure out where to take your pet, especially in the wee hours of the morning. So it's always a good idea just to have that bookmark as well as the pet poison helpline, so that you can easily know if something happens, I know where to go. So I'm going to just leave this slide up for a second because I know Erica will touch base on this. And then if there's any questions at all, feel free to throw them into the chat. But I hope this was helpful. And I think this recording will be also available in the Clubhouse shortly after. Erica?
Yes. Thank you so much. That was amazing. I actually didn't realize that some of those things aren't as toxic as they're made to believe. I did actually have a question came to my own mind when you were talking about the human medications, such as like phenobarb.
Mm-hmm.
I know I actually had a dog that was prescribed that from a vet. Is it toxic with humans because of the dosage?
Yes, exactly. Yeah, it's a very different dose than they use in people. But some of the anticonvulsants that are used in people, we do not use in pets. And not to say that maybe at some point we won't, but there are many that we don't know the right dose and we don't know how it's filtered. And often it's not just one. So it's very rare for us. Usually when that happens, it's mom or dad was on the medication and their dog or cat is on a medication and they swapped. And so it's just one dose. But usually when dogs or cats get into something like that, it's typically an ingestion, like the whole bottle or several tablets. And typically the dose is too toxic.
Okay, perfect. And then the other question I had is I've seen garlic used in certain treats, dog food, or like natural flea and tick remedies, I guess, for dogs. So it's not a good thing for them to have, correct?
Well, again, it's the cats. That's why I had it in the cat section. It's definitely worse for cats. For dogs, it's more dose dependent.
Okay.
So just like I said with the chocolate, like if you had a sprinkle of garlic powder for a Newfoundland that got into it, probably won't do much, but for a small cat, it is a big deal. So the natural products, just as an FYI, they do not go through, most of them, some of them have, but most of them have not gone through rigorous safety studies like the prescriptive or veterinary recommended products, who've had to go through that to be passed by the USDA or FDA if they're prescriptive. So keep that in mind. With natural things, it's best to have a conversation with your veterinarian or a care coach to make sure that we are actually understanding what's truly in the product, and if it's gone through testing, to make sure it is actually safe for your dog or cat.
Perfect. Well, that makes sense.
Yeah.
So if anyone has any last minute questions, drop them in the chat. And I'll just briefly kind of touch base on this graphic here that you see. So if you heard about this webinar, you are probably already in the Clubhouse, which is our community for AskVet members and non-members, to kind of just have fun and connect with other pet parents out there, and also have events like this, the webinar. We also have, as an AskVet member, a rainy day fund and 24/7 vet support. And we do have care coaches who offer personalized pet plans. If you saw yesterday in the Clubhouse, we did a live personalized pet plan, so you could see what that entails, kind of get a little glimpse of it. If you are not a member and this is something that you are wanting information on, you can go to your app store, download the app. If you have any questions regarding this webinar or any past webinars, feel free to reach out to one of us and the vet staff, and they'll be able to help you out and answer your questions. So thank you so much. And I hope you guys have an amazing day. Thank you, Dr. Marks. Wonderful as always.
Oh, thanks. So I hope it helps. Let us know if we can do anything.
Perfect. Thank you. Have a great day, guys.